And then let's talk about the materials. The first is a tourniquet, and then glove, one pair. Alcohol swab soap with a 70% with ethyl alcohol with a cotton and dry cotton. And plaster are adhesive strip. And painted tube. We also have a disposable family styling needle. 21 G is better. And that's it. Alright, so we have covered all of the different tubes that you will be typically drawing for your passion. And so now let's go ahead and talk about what the actual proper order of draw is. And if you haven't figured it out yet, well, surprise orders are. We actually just went through everything in proper order, but just to refresh your bring this up again here. So first thing that we want to draw just bird culture. And again, think of this our still line, and then it's going to be our light blue. Again, think our coagulation study. Next will be our lead top tube. Here, lead top tube. These are not so commonly used in chemistry tube in addition to our codes, SST tube, again, not so common chemistry tube. Typically used for our standout test, and then from there we have our green top tube, which is gonna be our common chemistry tube. Alright, then next is going to be a purple top tube, and it's gonna be those are hematology study. Other is pink top, which is our blood type study, and finally is our gay top. Here is gay top. Yeah. Some of these tests like lactic acid rising, glucose, and ethanol, and so is our order of here really kind of matter. That's important that we have our blood culture being done first, because we don't want to risk contaminating those by filling out some of their other tube and then putting blood into the blood culture bottle. But then if you look at really the first actual blood collections tube we do as a light blue tube is our dose hematology study, because it has that different ratio of that sodium citrate, and so that we can get an accurate assessment of a patient's coagulation factor and clotting time. And if we get some of these additions, such as the green heparin, that gets in here the gasometer of our result, your coagulation study. Also, in addition to that, if you remember on pink or purple to have an EDTA here, which is, if you think about it, is a high in potassium, but then also by calcium. So, like I said, I'm gonna give you a quick little acronym that hopefully will help you to be able to remember the proper order in which to draw list. So here it is SLRSGPLG. It's gonna be stop, light, red, stay, green, power, light, go. So the procedure: first, remember, identify the patterns. Two forms of active identification are required. Ask the patient to state their name and date of birth. This information must match the requisition. Reassure the patient that the minimum amount of blood required for testing will be done, and notify that any diet or time restriction have been met. And then and order of draws. Okay, and then assemble the necessary equipment appropriate to the patient's physical characteristic. Then wash hands and put on gloves. Here, put on gloves. Position the patients with the arm extended to the form of straight line from shoulder to wrist. Do not attempt a venipuncture more than twice. Notify your supervisor and select the appropriate vein for venipuncture. The larger median cubital cephalic veins and basilic vein most frequently uses, but other may be necessary and will become more prominent if the patient crosses his fist tightly. Okay, and apply tourniquet. So first, we apply a tourniquet 3 to 4 inches above the collection site. Never leave the tourniquet on for over 1 minute. And if the tourniquet is used for preliminary vein selection, release it and reapply after 2 minutes. Alright. So after that, we clean the puncture size by making a smooth circular pass over the size with the 70% alcohol, moving in and outward spiral from the zone penetration. Allow the skin dry before proceeding. Do not touch the puncture site after cleansing. Perform the venipuncture. Attach the appropriate needle to the head by removing the plastic cap over the small end of the needle and insert into the head to it tight. Okay. Venipuncture procedure using a siren. Press a sheath needle on the siren and remove the cap and turn the bevel out. And prune the skin tight with your thumb or index finger just below the puncture site. And holding the needle in line with the vein, use a quick small thrust to penetrate the skin and vein in one motion. We insert the needle about 15 to 30-degree angle into the vessel and draw the blood to get the amount of blood by pulling back to the saline stipper. And when it's enough, just prune out the tourniquet. And use the cotton. Press and pull out the needle. Use the tape cover to stop breathing. That's it.